Introduction to Psychiatry. Psychiatry is a very fascinating field. People have been thinking about psychiatry and mental illness for millennia. Since the humans have been getting into this organized groups in civilization, people have been having problems with their mind. People have thought how to go about dealing with these problems of the mind. Now in the current days, psychiatry is a specialty of medicine which deals with diagnosing, that's making out the illnesses and treating, getting patients better, and also preventing mental illness in human beings. And people always have this apprehension about illness of mind. What would be considered an illness of mind? Is it a mother who loses her child and gets depressed and then feels that her life is worthless without the child? Is that mental illness? Or the same mother, after 1 year of losing the child, continues to cook a meal for the child every evening and waiting for the child to come home? Is that mental illness? Or mental illness is something wherein somebody is wandering on the streets, taking away the clothes and behaving in a very disinhibited fashion. So mental illness can be very varied. Or an elderly person who is in his 70s losing his memory, is that mental illness? Or somebody who's being incontinent, passing urine in his own clothes and not knowing the way about in his own house, is that dementia? So mental illness can be very varied, and mental illness can spread from simple things like a grief reaction, wherein somebody who is very sad and depressed after losing a loved one, to a severe illness wherein people lose touch with reality, wherein they start hearing voices in their head or believing that people are conspiring against them and planning and trying to kill them. Which is not in keeping with the cultural context or in keeping with the reality around the person. So mental illness is a very varied and controversial subject. In the past, if we start looking at the thousands of years of human evolution, say if you go about 4,000 or 5,000 years ago, people did not have a major understanding of mind, and they would think perhaps somebody is getting depressed or somebody is behaving abnormally. They might have attributed it to the spirits, and they would have thought this is something which is done by an external alien or divine or maleficent forces which were causing this person to behave in a certain way, and look for healing methods and understanding the illness based on the cultural context. In the past, about 3,000 or 4,000 years ago, if you look at the various cultures, they were putting holes in the head, that's called trephining, wherein they would say put a hole into the head so that they would let out the evil spirit out of the brain, and thereby getting people better. And some thought, especially when it came to Socrates, they thought it's because of certain parts of the body, like hysteria. They thought it was because of a problem with the womb or the uterus. They thought the uterus wanders around in the body, thereby causing women especially to behave abnormally and in a silly fashion or in a different way. Thereby the wandering uterus was responsible for hysteria. And then if you look at go back and look into the older constructs, Indian tradition has been trying to understand mind in lots of ways. Indian tradition says yadhomati tadogati, the way mind thinks, the world or your destiny is guided by that. Or yad bhavam tad bhavati, the way you feel, the world manifests around you in the same way. So mind has been an integral part of Indian thinking. If you look at Bhagavad Gita, Lord Krishna defines different types of personalities, which we now, most of the time, like the current classification system also looks at personality types and pathological personalities. Krishna talks about tamasic personality. These are the people who are generally lazy, not interested in the world. They are looking at interests which are not particularly ideal, not so good for themselves or the society. And Krishna speaks about Rajasic personality. These are the people who are fruit-driven. They want to go about achieving things, whether in the right means or wrong means, but they want to achieve things, and they are driven by passion and they are driven by emotion. And then he speaks about Sattvic personality, those who are working in the interest of themselves and looking for higher goals for themselves and the society. So the personality types have been described by Krishna in great detail in both Karma Yoga and other parts of the Bhagavad Gita. And if you go for a bit into the Indian Indian medical system, Charaka Samhita does talk about the Triguna theory. Triguna theory is about three particular components or humors. It's exactly, if you look at it, it's Tridosha theory rather than Triguna theory, but it's synonymously used. Charaka describes about Vata, Pitta and Kapha. These are the three humors wherein when there is imbalance between Vata or Pitta or Kapha, so it leads to mental illness. And the terms are even in Tamil, they use this word called Paitikari or Pitta dosha, wherein Paitikari is somebody who behaves abnormally and which is attributed to the Pitta dosha or the problem with the bile, so, or the green bile, which again, if you look at Greeks and Romans, especially the Greeks, they talk about the yellow bile or the green bile, which is responsible for mental illness, wherein people behave abnormally because of the problems with the bile. So there seems to be a universal way of thinking. The world has been more or less, there have been memes around or the similar thinking patterns across the globe at the same time, in the same lines, wherein there are certain humors or components in the body which are either, they might call it an enzyme or a humor or a guna or a dosha or tattva, which leads to disturbance in behavior of a person, which can manifest as an illness, which is grossly deviant from the cultural norms and expected social norms and acceptable social norms, which leads to quite a lot of distress to the individual who is suffering that and also to the people around. And WHO says that health is not just mere absence of disease, but complete physical and also mental well-being. So ability to enjoy life in a psychological way is an integral part of World Health Organization definition. So whenever people miss out on that, that's what is mental illness. Mental illness. What did people do in the past? I did talk about drilling holes into the head in the past to drive out the demons around. And later people thought like, these people are actually afflicted by this major horrible evil spirits and they'll have to be sort of exorcised, taken to places of healing. In Roman times there were temples perhaps, where they used to take them and then heal them into these temples where they were given some special treatments. Romans were literally, a bit kinder than perhaps Greeks in the earlier days and probably much more tribal-based civilizations in the West, wherein people were drilling holes into the head or beating them up with religious scriptures or books. And sometimes they used to beat the people so badly that they fall unconscious, almost die, in order to get the evil spirits of the body. And during certain periods, this is probably in the Middle Ages perhaps, if you look at anywhere between 11th and 15th century, you look at it, the predominant way of treating was either to beat the spirits out, or there was a time they were thought that they were devil incarnate, people with learning disability, people with epilepsy. They thought that these guys or these patients were perhaps representing devil, and some of them were actually burnt to death or drowned to death. Malleus Maleficarum, this is a book written around that time. It talks about the learning disabled, or what we call as the mentally retarded in quotes. These people were thought to be devil incarnate and they were killed by the people. And later, perhaps after the church got separated from the science, things became a bit kinder. Later part of 15th, 16th century and later after the French Revolution, they said mentally ill people are perhaps not actually bad people, or they are not possessed by spirits, but there's something wrong with them. They have to be treated a bit more kindly and with compassion. And prior to that, people were chained to the walls, left aside to die, rot, and some people thought they were burdened to the society and they were not even fed and taken care of, and they would die of infections, die of malnourishment, and various other reasons. And later, when Pinel is a socialist movement guy in France, he decided, like, he at the Salpêtre Center in France, he decided after the French Revolution the ideas were changing, people were becoming more humanistic. He said all these mentally ill people will have to be unchained. And unchaining was first sort of taking place in France, and it later spread to Britain, where in Ealing Hospital, R.D. Laing was another psychiatrist who's decided, like, unchaining has to happen, and more humane treatments and more inclusive treatments started getting in, and people were treated with more compassion and kindness, and they felt that these are the people who actually need more help. And it went on. As we moved into the first half of the 20th century, then things are slightly different, wherein people were moved into asylums, wherein huge hospitals were built. I had the pleasure of working in one of those hospitals which had a mile-long corridor, along with having fields wherein patients could work themselves, work the fields and have some productive life for themselves. And if they were getting better, government started including this criterion where there would be a group of people, so-called well-wishers or social workers or kind of people in the society. They would come together and decide, oh, this person is now better, he can be reintegrated into the mainstream society. So there was a bit of legislation coming into the place, and it was gradually getting into mental illness from a social, religious belief system to a medicalized system, wherein they were treated as patients rather than people who were bad or devil incarnate or possessed by spirits. So this transition gradually led into much more treatment-based approaches, wherein people were provided work, provided care and compassion, nutrition, and the self-care. This was the primary thing which happened till mid-50s. And something dramatic has happened in 1950s. A particular drug called chlorpromazine got invented in 1952. This led to a rapid shift in psychiatry from the kinder, compassion-based treatments to a medicalized approach. Psychiatrists became more confident. People in the past were custodians, psychiatrists were custodians of these people. Now they are actually being treated as doctors who were taking care, and medical specialty as psychiatry started evolving in a much more serious fashion. After the introduction of chlorpromazine, surprisingly, lots of patients were getting better. They found this interesting thing, a molecule in the brain called, a particular neurotransmitter in the brain called dopamine. And that seems to play the trick in patients who were earlier wandering, taking their clothes off, talking to themselves, uttering abuses, behaving in very bizarre fashion. And in the past, as I was talking about this particular place called now the Maudsley, but the Bethlehem Hospital, wherein these people were viewed like circus animals, wherein they had to pay a penny to view on a Thursday. They were called the first Thursday viewings or whatever, wherein people were paying to visit these people as if they were put in a zoo. From there, since after 1950s, people were treated like this is something which is inhuman, and medication is something which helps, and dopamine is perhaps the chemical. The shift from a social approach to brain-based approaches gradually began after 50s. And interestingly, after that, these huge asylums started shrinking because people were now getting back into the community, finding jobs, getting back into the families. Families were more accepting because these guys are not behaving, these patients are not behaving abnormally, but they were actually productive members of society, finding work, contributing to the family, and perhaps contributing to the state in the form of taxes. And people started seeing, oh, this is something actually is treatable and it can get better. Now, as psychiatry started evolving into a science and a medical specialty, people started looking that all psychiatric patients are not the same. Some have simple problems, like they get anxious or they get worried, some get depressed, and some seem to have a very different form of illness. They seem to be talking to themselves, they were not taking care of themselves, and they would not care about the world around themselves, and they behave as if they are in a conversation with someone. And an interesting phenomenon started happening. They started looking at different types of illness. Now, from being a word, for want of better words, from lunacy to mental illness people started saying perhaps it's not a simple single illness, but there are different types of illness among mental illnesses. So they started working towards what is called a classificatory system. Now we have a person called Kraepelin. He said there is something about one particular group of patients which makes you very uncomfortable in the chest. It's called a precox feeling. That's inside myself, I feel different when I see this patient. So he said it's dementia precox. He said, like, these people seem to lose their ability to think clearly at a much younger age, and they have this psychiatrist or the treating physician was having a precox feeling about that. And he said this particular people seem to have very poor prognosis, or they were not particularly doing well. As things progressed, a gentleman called Bloiler said, oh, this is not actually dementia, this is not a decline in cognition, but it's a problem with thinking. He said, he called the word, he used the word called schizophrenia. Schizophrenia is about losing contact with reality. It's the disconnect rather than split with the reality is the core principle which Bloiler said. And Bloiler said, interestingly, there are 4 features about this illness. There is a private way of thinking for these individuals which doesn't keep with the social way. And then he said, like, they seem to be ambivalent whether to do things or not to do things, do things or not to do things. So there is this a private way of thinking, an ambivalence, and withdrawal from society, and there is a slowing down of thinking process. So with this combination, he said, oh, this particular group of people could be something called schizophrenia, and rest are all better prognosis ones. And WHO stepped in later into the 60s, 70s. They said there should be a classificatory system for all illnesses, including psychiatric illness, and they came with the International Classification of Diseases, or ICD, and the current version is ICD-10. It's the 10th version, and probably in the next few years we'll be looking towards the 11th revision of International Classificatory System of Diseases. And chapter 5, or the F category as it's called, it deals with mental illness from 1 to 100 codings, and different illnesses are all included into that. And it's one beautiful part of International Classificatory System is that it's non-profit, WHO funded classificatory system, which is inclusive, especially a model for developing nations and such as India, Africa, and other even in Europe. It's a major classificatory system. Americans went on to talk about DSM-5. DSM-5 is the current version, or Diagnostics and Statistical Manual. DSM came into being, and now the 5th version, they said now DSM has to be much more scientific and research driven, and DSM-5 now is much more research driven after the Connectome project. Connectome project is wherein now most of the brain connections are being mapped, and every diagnostic category should have a basis in the brain. That has been the DSM-5 motto, and they seem to have done very well. But the caveat which goes with the DSM is that it's funded, there is profit motive involved, and it's supported by American Psychiatric Association, and DSM is in itself is a funded organization, so it's not a non-profit organization. And if you go further now, after classificatory systems, there is of course various other categories and various other classificatory systems as we look in, but these are the major systems which are used, ICD and DSM-5, and China is now working towards its own classificatory system, especially with cross-cultural references, because what might be true for an American person might not be true for an Indian person or a Chinese person. Especially there are certain categories in Japan and China which is called neurasthenia, wherein people feel weak, or there is something special mention about qi or chi, that's spelled as CHI, wherein you lose the chi or energy, people feel drained and fatigued. So that's not particularly referenced in the West. So there is a need for individual or specialized classificatory system for Orient, and probably Indian systems like possession states. We get to see lots of young women, mostly, and men being possessed by gods and demons and spirits. They tend to behave abnormally in certain way for a certain period of time, and that seems to have a very little mention in ICD-10 or DSM-5, wherein DSM-5 looks at it as multiple personality and ICD-10 has possession states. But these cultural influences obviously need and Indian Psychiatric Society is looking towards working on probably a classificatory system for India itself, but that we are very long way from an independent classificatory system for India itself. Going on further from classificatory systems, psychiatry, as we were talking about, is various types of illnesses. It can range from dementia. Dementia is wherein people lose their memory and cognition's ability to think. So a person who has been doing very well, about 60-65 years of age, who is otherwise considered to be a very bright person. I had a patient who was a professor in a very specialized field. He would remember things about his childhood, like he knows where his sister lived, where he was born, and the route in the village. But he was forgetting things like what he had for breakfast, perhaps, or who he was supposed to meet. He would forget his door number at times, or lose his way in his own house. So this is something called dementia. Dementia can be various subtypes like an Alzheimer's or frontal lobe dementias or frontotemporal lobe dementias or Lewy body dementias. So dementias is a category which deals with memory dysfunction and cognitive dysfunction. And along with that you have later, if you look at it, the brain-based major illnesses, you have addictions. Addictions can be dependence on alcohol, which is the commonest dependence which causes problems in the society, wherein people drink a lot, even after knowing that it's harming their personal lives, it's harming their physical health, it's harming their memories and psychological health. And to the extent some people during withdrawal can get into fits, and some die. And there is a condition called delirium tremens, which happens during withdrawal, which has a very high degree of mortality. People can die during DTs or delirium tremens. And people still continue to consume alcohol or tobacco, or chewing tobacco, or in smoking tobacco. And now with the advent of modernization and globalization, you would find India was a very small consumer for other exotic products like cocaine or ecstasy or MDMA or ketamine or other sort of drugs which were very rarely available in India, but with the available disposable income and nuclear families, we seem to see more addiction towards cocaine, cannabis, and other products, which is a major issue which our country will continue to face and will have an impact on young people on long term. And that we have schizophrenia and other psychotic conditions. This is a very interesting illness. I was talking about Kraepelin and Bloiler talking about this illness, the precox feeling and also the 4 features of Bloiler. This is an illness which is predominantly characterized by delusions and hallucinations, and most of them are paranoid. These people who suffer from schizophrenia, it generally starts in 2nd or 3rd decade of life, and it manifests in the form of people believing that there is somebody out there trying to harm them, or there are people who are conspiring against them, and they believe it firmly even after presenting the evidence, saying that, look, there is nobody, or the wife says there is nobody out there to kill you. They think that their wives also might be against them, or husbands might be against them. And they sometimes can hear voices. They might hear voices saying bad things about them directly to them, or they might hear voices talking amongst themselves. The voices in 3rd person talking about this person's actions or commenting on this person's actions. And sometimes schizophrenic patients can have bizarre thoughts. They might believe that aliens are there out there and put a chip in their head, and then controlling their thoughts, controlling their bodies, and they might actually act impulsively because of this phenomenon of thought control or thought broadcast. They might feel that others can hear their thoughts, others can control their thoughts. So this thought eludation phenomenon, which can occur in schizophrenia, is a hallmark which was predominantly described by a person called Schneider. They are called Schneider's first rank symptoms, though they are not specific to schizophrenia, still have a valid connotation as we go along the history of psychiatry and understanding of psychiatry. And amongst the other spectrum of disorders, which we commonly get to hear, is bipolar illness. Bipolarity is a very interesting phenomenon. There might be times when these patients believe that their moods are very high. They might think that they're either gifted, they're very special, they believe that they might be kings, or they might believe that they have the abilities to heal people, or they're very rich. So you might have seen sometimes in your lives that there are these people who believe that they're connected to big people, or they're specially gifted by God to go about doing these dramatic things. They don't think they need any sleep. They cannot wait for their turn. They are so pressured in their speech. And that is one pole, which is called the mania or hypomanic pole. And the other pole is depression, wherein they feel that the same patient who was so high at a time, now he starts thinking that, life is worthless, life is useless, what's the point of living? You might as well kill yourself. That sort of negative thought can set in when they're depressed. So bipolarity can have the higher pole or the manic pole and depression pole. Now the current understanding is that depression poles can sometimes be missed, and you can have just episodes of mania, which is another category, which might need another classificatory system at a later date, but now it's still categorized under bipolarity. And then you have depressive illness. Depression is a very, very common condition. Depression is not like, somebody fails an exam and feels sad. It's not depression. Depression is a very intense feeling of helpless, hopeless state, wherein people don't find any joy in anything in their lives. They don't find meaning or purpose in life. They don't have energy, they don't have ability to connect, and they don't see any purpose in their lives. And it can go on for several months and years, and if untreated, people can kill themselves. A significant number of patients, 15% of patients with depression kill themselves. And when people die with suicides, probably 60% are attributable to some form of mental illness or others. So depression is an illness which is very treatable and which needs urgent intervention. And this is something I urge viewers to keep a close eye. If you have any relative or your friend or somebody known to you who's suffering with depression, the signs would be lack of sleep, having no interest in pleasurable activity, and feeling sad most of the time, most of the days, no appetite, and finding life purposeless, meaningless, with hopelessness, helplessness, and guilt. And people feel that this is not going to get any better, and they're a burden to the family, and the family would be better off without them. They might as well die. These sort of negative cognitions, and the life is never going to get better, is a hallmark of depression. So keep a close eye. Depression is an important treatable illness, and most of the world is working towards defeating depression and daring to care for depressed patients. That's major motto, and India needs to work more on that. The other conditions are anxiety disorders, people having generalized anxiety, wherein people feeling that they're worried about something. These are called the worriers. I mean, they feel their hearts are racing faster, their mouth dries up, they feel something awful is going to happen. It's a bit worse than having examination anxiety. This is present most of the time. Sometimes it can take an intense form of a panic attack or worrying attack. And then we did talk about possessions, people getting possessed by evil spirits, so other major spirits. Then we have personality disorders. We did talk about personality disorders in a brief way when I spoke about Bhagavad Gita's Krishna's thing, but you specifically need to look at antisocial personality disorders, who are more into criminal behavior. They offend and they have no sense of guilt or remorse. They don't care for others' feelings. And then you have borderline personality patients who tend to cut themselves more often. They're very dramatic in their behavior. They tend to take overdoses, threaten to kill themselves, and they're not happy with interpersonal relationships. The other spectrum is learning disabilities, which we earlier used to call it a mental retardation, autism, which can be seen in children as they grow up into adults, and disorders of emotion in children. And quickly into the care, we have a biopsychosocial model, especially to understand the vulnerability, why mental illness happens. The biological vulnerabilities would be if you have a family member or parent or relative that's first degree relative with mental illness, the likelihood of especially schizophrenia or bipolar disorder happening is much higher. And then psychological vulnerability. If a young person loses a mother before the age of 5, they are more vulnerable to depression, and being under constant stress can make them vulnerable to mental illness. And social factors like unemployed, being in a very low subjugated situation or having a very difficult boss can lead to depressive illness. Overall, to recapitulate, psychiatry is a very fascinating field, and understanding mind and mental illness is an exciting field of medicine, which is driven by people with passion, with understanding mind's anatomy, brain's anatomy, and neurochemistry of brain. And as we looked into the history of psychiatry and the current understanding, we need to understand the biopsychosocial model, the biological factors, the psychological factors, and the social factors in causation as well as maintenance of the illness, and also treatment. We have biological ways of treating patients with illness. That's with medicines. Sometimes people are given electroconvulsive therapy or shock therapy, though it's got bad press, but it's a very effective treatment in severely depressed patients. And then newer forms of treatment like magnetic stimulation of brain and other things are available. And the psychological treatments, that's the psychoanalysis, which is developed by Freud, Carl Jung, and others, which are very important in treatments. And also cognitive behavior therapy is a very effective therapy, which is very structured and is in the vogue at the current time. And family therapies play a major role. And then you have social interventions. The 3-hospital study, which is an interesting study, which says providing patients with basic amenities and a bit of degree of respect and care, and providing status in society by getting them into an occupation and a rehabilitation mode. This seemed to work in combination. The biological, psychological, and social treatments together help patients get back to the normality. And in a single statement, if I have to say, mental illness is like any other physical illness, like a diabetes or hypertension or a cardiac illness. It's treatable and the outcomes are very good. So mental illness is something which can be addressed at an early stage. It has better prognosis than we thought of earlier. Thank you.